your mind. A first-of-its-kind study is actually proving that that might be true. European researchers scanned the brains of women who had never conceived before and again after they gave birth for the first time. The results? Well, pregnancy actually changes a woman's brain, leading to less gray matter. So they actually have less gray matter in their brain after they had a baby. However, that may not actually be as negative as it sounds. Let's talk about this with Dr. Kimberly Gatesy, OBGYN at Cleveland Medical Center's University Hospital, and Dr. David Gary, Director of Fetal and Maternal Medicine at Stony Brook University. It's nice to have you both, and we know that you're both parents as well, so you'll have some personal experience to bring to this. Dr. Gatesy, it's not as negative as it sounds. Talk to us a little bit about that.
No, it's definitely not as negative as it sounds. It's actually a very positive thing. What the changes in the brain that they noticed in this study were in areas of the brain that work on social cues and allowing us to be able to be more empathetic or be able to put ourselves in someone else's shoes, namely our newborn infant. So it really helps new mothers be able to adapt to their infant's social cues and really be able to take the excellent care that women want to be able to take care of their babies.
We should mention, Dr. Gary, that the change takes place not only immediately after you give birth for up to 2 years, they think, and they're going to be doing more studies. So why exactly does that happen?
Well, it apparently there's as pregnancy has its effect on the brain, there's a change, or what was called a pruning, as information in areas develop to adapt for post-pregnancy care of the patient or care of your newborn. So in a sense, it's a remodeling, and that remodeling also occurs in adolescence and also, so at the time of adolescence and then again when you have a baby. So there's some changes that go on, and whether they reverse or not over time still remains to be seen.
That's interesting. I like the idea of pruning, Dr. Gates. That makes it sound a little bit more positive than that feeling of that you don't actually know what's going on a daily basis. I mean, what would a woman experience if this is happening to her physically? How, in real life, how would this play out?
You know, it's hard to know if really the woman notices anything different. I mean, certainly the experience of pregnancy and childbirth is completely life-altering for a woman, and she definitely feels that that change in her interest. I mean, all that she is concerned about is that newborn infant, and so she definitely notices that. I think it's also important to note that in this study they did test women's cognition, or their memory and their thinking ability before and after pregnancy, and there weren't any changes there. So it's not that she's going to feel like she's, as you said at the beginning, losing her mind or not as smart or can't remember anything anymore, even though the lack of sleep and just the act of taking care of a newborn can certainly make you feel that way.
Well, and maybe I'm projecting a little bit. From my real life experience. You know, Dr. Gary, we wanted to talk to you as well because, you know, they actually looked at the dad too and his brain, and they didn't notice any changes with the dad. I mean, although sleep deprivation affects everybody, and I'm curious how you look at that, Dr. Gary, as a father, but also as a physician.
Well, I think, yes, they did look at the men, and there were no changes. I can tell you, and they actually looked at the men with respect to the sleep deprivation, etc. And from a personal point of view, yes, I experienced taking care of my newborn children, sleep deprivation. I was actually sometimes happy to go to work. But I guess in the long run, or you know, why are these differences occurring? We don't know. And does it have to do with the adaptation to, in other words, how you care for the newborn? And males have sort of a different role, you know, as far as developmentally over time. And maybe that's why the female brain changes to better care for the newborn.
That's very interesting, and we appreciate that honesty, Dr. Gary. I think we can all understand sometimes you just need to get out of the house. All of us do.
Yes.
Dr. Casey, Dr. Gary, great to have you with an interesting study. We'll wait for follow-up studies for a little bit more information, and we'd love to have you back. Thank you.
Thank you so much.
Thank you.
We've worked